There is no other relationship like a breastfeeding relationship.
It's a bond that you develop with your baby that nobody else gets.
Even if you have just one mom every year who wants to breastfeed, it is so important to have a policy. A breastfeeding policy, first of all, answers a lot of common questions.
It provides a standard of care so that all of the staff and the patients know that we're coming from the same place and providing the same level of care.
Truly it helps to provide a very baby-focused patient care and a better care to all families.
They're building a trusting relationship. So if they're hearing the same message amongst various team members as well as various partners within the building, it gives them that confidence. It gives them confidence in making a decision that's best for them.
We support breastfeeding no matter what, no matter where. So whether that's someone who comes into the hospital and they're here with their family member and they feel like they can feel welcome and supported to breastfeed, that they have an area to do that if they need privacy, which of course isn't necessary, but sometimes people would like that, or if they need something comfortable, places to be. We want people to feel welcome to breastfeed no matter what the reason we're here is.
The breastfeeding policy clearly reflects that the baby-friendly initiative supports all families, even families who do not choose to breastfeed.
We have our policy in a shortened version in poster form, and all of our families are acknowledge that we are baby friendly, and I think that speaks volumes because we are in a community where one of our hospitals, Grand River, is already accredited. Our public health unit's accredited, so I think the public is aware of what BFI is. So I think it's a selling point for us, isn't it?
I think having the edited version posted throughout the building really helps to start the conversation.
I remember during my induction actually seeing the policy on the bulletin board next to my bed, and I remember laughing, thinking, this is a great focal point during a contraction. When I'm feeling pain, I'm going to read each one of these steps. I just remember reading all of the different points and knowing that I was in good hands because of all of these steps that the healthcare providers had to take in order to achieve this baby-friendly designation.
So we used the template that was available to create a policy. Our core team members incorporated the mission, vision, and values of Langs.
We looked at many different policies. Back in 2009, 2010, there wasn't a whole lot to choose from, but we sort of looked at several and put them together and sort of made them our own. Our policy is easily accessible. We have it on our common documents, so everybody can just click on the computer and go right to our policy. The last time we updated our policy, we put an appendix in regarding supporting the non-breastfeeding mom and making sure that their formula is accessible, feasible, sustainable, safe, etc. And then we did some training with our staff.
We used a collaborative approach to build our policy. We did that with our lactation consultant, who's playing an extremely active role, as well as our leadership team, and with input from our nurses and our staff that are providing the care at the bedside as well. We've been really successful in implementing it within our Women and Children's program, and that's been our focus to begin with, and we're just starting to branch out into the different parts of the organization in terms of places like the lab and the emergency department, and we've had great success and buy-in and partnership there as well. So we're hoping now to move into the other clinical and non-clinical areas as we continue to grow within our project.
Our team recently invited 3 members of the community to participate in our BFI working group, and one of those mothers exclusively breastfed, one exclusively bottle fed, and another mother did both. So they have given us invaluable information, and they've looked over all of our patient information, our posters, to make sure that we're speaking in a language that everybody can understand, and more importantly, a language that supports every woman's choice of how she wants to feed her infant following informed consent. Seeing our information through a different lens has provided valuable insight.
BFI is really a culture change throughout the whole institution. You start with FBU, but it certainly extends to the whole hospital, and how you reframing some of your thoughts about infant feeding and how we manage babies and how we treat them with respect. I think that's one of the striking things for BFI.
I think the grassroots people, the people who who wrote all the policies, and they had a much more difficult job. We were doing a lot more sharing from organization to organization, and I think that's important. You don't need to reinvent the wheel. It's a journey. You can't do it all in a day. It's a journey. It's an ongoing process. But the 10 steps really guide you. And if you just start with one and work your way through them, no one can do it for you. You have to experience it, and you have to work with people.
It's so beneficial to be on the baby-friendly journey, helping to promote and protect and support breastfeeding, protecting breastfeeding, increasing breastfeeding initiation and duration rates. Long-term will help with decreasing, hopefully, these rates of these high rates of diabetes and childhood obesity and cancers. With that in mind, it is a long-term initiative. It's a public health initiative, and we are committed to seeing generational changes. If you want to see more nurturing, more attachment, the building up of families, this is a great way to do it.
Baby friendly really matters to me, the baby friendly initiative and hospitals acquiring baby friendly initiative. They're so important.